For the iCARE study, you have been randomly selected to be in the MART group. MART stands for Maintenance and Reliever Therapy, meaning you will use the same inhaler for your daily maintenance and for quick relief or rescue. Why are we studying MART? Giving inhaled steroids when you need rescue medication has been shown to improve asthma control and decrease asthma attacks. Both MART and Partix, the other approach we are comparing to MART, have been shown to improve asthma. We are doing this study to understand how they compare in real life so we can understand when to prescribe one versus the other. This video will teach you how to do MART. Depending on your insurance, the MART inhalers can be Symbicort, Breyna, or Dulera. You will use this single combination inhaler as both your daily maintenance and rescue inhaler. This one inhaler will help prevent asthma symptoms as well as treat sudden symptoms that you would usually treat with your rescue inhaler, such as albuterol, Ventolin, ProAir, Combivent, Levalbuterol, or Xopenex.
The MART inhaler contains 2 asthma medicines. One medicine in the inhaler is a steroid that reduces inflammation in the lungs to help you breathe better. It is called an inhaled corticosteroid, or ICS. The other medicine relaxes the muscles in the lungs to open them up so you can breathe better. It is called a long-acting beta agonist, or LABA. The long-acting medicine in MART also works quickly, so it can be used instead of your rescue inhaler. That is why you will use your MART inhaler for both maintenance and when you would use a rescue inhaler. Therefore, you need to stop using your current rescue inhaler and use this MART inhaler instead for rescue. As we mentioned, the MART inhaler can be named Symbicort, Breyna, or Dulera. You will take the instructed number of puffs twice daily for your maintenance, and you will take 1 puff as needed of the MART inhaler the way you would use your current rescue inhaler when you have increased shortness of breath, wheezing, or chest tightness. Some people take 2 puffs of their rescue inhaler when they experience asthma symptoms. We recommend you only take 1 puff of the Symbicort, Breyna, or Dulera that has been prescribed for MART. You can take another puff of the MART inhaler if you need it in 5 to 10 minutes, the way you would take another puff of your rescue inhaler if you still have symptoms. Please, always carry the MART inhaler with you so you can use it for rescue. Do not use more than a total of 12 puffs of the MART inhaler a day. That includes the maintenance doses and the rescue doses to add up to 12. For example, if you are taking 2 puffs of maintenance twice a day and then use 9 puffs for relief of symptoms, that would be 13 puffs. If you have taken 12 puffs of your MART inhaler in a day, please call the doctor or nurse who usually manages your asthma so they can help make sure you get any additional treatment if needed. Using 12 puffs suggests that your asthma is out of control or that you may be having an asthma attack. If at any point you are unable to speak in full sentences, unable to lie down flat, or having lots of trouble breathing, seek medical help immediately or call 911. As a reminder, each time you take a puff of the MART inhaler, you want to have the inhaler up to your mouth. Take a nice, slow, deep breath in as you push the inhaler button, and then hold your breath for 5 seconds or as long as you can to allow the medicine to get deep into your lungs. Then you can breathe out. What if I need to use a nebulizer for my reliever? If you need to use a nebulizer for rescue reliever, you should not take puffs of your MART inhaler at the same time. You can continue to take MART for your twice-a-day maintenance and whenever you would use your albuterol or rescue inhaler, but not when you use your nebulizer for a rescue treatment. Our study doctors will prescribe the MART inhalers for you. Depending on your insurance and the phase of the study, we will write you a 1-month or 3-month prescription, which should include enough inhalers to go past a month or past 3 months. How long past those times will depend on how often you have to use the MART inhaler as rescue. We will provide you with a packet of additional study information.
How does the study keep track of how you're doing? Each month, you will receive a short set of questions to answer. The questions can be answered on your smartphone or computer, or you can be called to complete questions each month. Please let us know which way is better for you. Because the questions are very important to the study, Each month, we will send you reminders to answer the questions and pay you $20 for each of the surveys you complete. Let's review. Your current maintenance inhaler and your rescue inhaler will be replaced by MART, either Symbicort, Breyna, or Dulera. You should no longer use your current rescue inhalers such as albuterol, Ventolin, ProAir, Combivent, Lavalbuterol, or Xopenex. You will use your MART inhaler, Symbicort, Breyna, or Dulera, as directed twice a day, even when you are feeling well, to keep your asthma under control. If you have asthma symptoms like wheezing, shortness of breath, chest tightness or cough, or other symptoms where you would use a rescue inhaler, you will take a puff of the MART inhaler, Symbicort, Breyna, or Dulera, as needed for rescue. If needed, you can repeat another puff in 5 to 10 minutes. If you need to use your nebulizer for rescue, do not use the MART inhaler at the same time. As a safety point, do not use more than a total of 12 puffs of the MART inhaler a day. That includes the maintenance doses and the rescue doses to add up to the 12. For example, if you are taking 2 puffs of maintenance twice a day and then use 9 puffs for relief symptoms, that would be 13 puffs. If you have taken 12 puffs of your MART inhaler in a day, please call the doctor or nurse who usually manages your asthma so they can get help to make sure you get any additional treatment if needed. Using 12 puffs suggests that your asthma is out of control, or that you may be having an asthma attack. If at any point you are unable to speak in full sentences, unable to lie down flat, or having lots of trouble breathing, seek medical help immediately or call 911. If you have problems with your asthma during the study, like having to go to the emergency room or hospital, or having a worsening of your asthma, we may call you to ask some extra questions. Thank you for watching this video to learn how to do MART, and for being in our study. A study coordinator will now ask you to review what you have learned and answer any questions you have.